Hi everyone, my name is Maria Brazili. I'm an expanded functions dental assistant, and this is the life of a dental assistant. Let's be honest, no one loves going to the dentist. When we think about the dentist, we think about being poked and prodded. We think about getting lectured about flossing and brushing better. And everyone just kind of has a sour taste in their mouth when it comes to the dentist. But as an assistant, it's my job to make every visit a little bit better for each person that comes in. Also to help educate them so that in the future, when they do come in for this dental visit, we're not having this same reaction of, I don't want to be here because it's going to hurt and you're going to tell me things that I'm doing wrong. So we're going to change this as a dental assistant and help the patient make good habits so that when they do come to the dentist, we're getting a good report and having a nice, clean, healthy appointment. What will you learn as a dental assistant? So you will get to learn how to assist the dentist. You'll learn how to take dental x-rays. You'll learn how to pour dental impressions. This will make it so that you're able to make things like whitening trays or retainers or night guards for patients. Dental assistants make a difference by just helping to calm the patient. They also do a lot of patient education, and they're kind of the heart of the dental team. If the office is getting behind, it's the dental assistant who's going to be the one to help out the hygienist or help out the doctor. So they kind of have their hands in a little bit of everything. So, what's a day in a life of an assistant look like? So, first of all, we're usually the first one in the room at the beginning of the day, and that means that we need to prep all of our treatment rooms. So, that's turning on lights, turning on pumps, turning on all of our computers, making sure that everything's nice and clean, get our room set up for the day. Also, we'll be sterilizing instruments. So that just means that after we use them on a patient, they will go to what we call an autoclave that heat sterilizes our instruments. So then they're nice and safe for the next patient that we use them on. We're also going to assist the dentist as well. So this could mean mixing different dental materials. This can mean suctioning. This can mean passing instruments, just anything that has to do with helping the dentist throughout that appointment and the different procedures. The assistant's also normally the one who's going to be taking all of the dental x-rays. You do need a certification for that. And so most assistants to be able to work at that entry level need to have some kind of x-ray certification. And then lastly, and I would say most importantly, is making our patients feel comfortable. The working environment for a dental assistant. So you could work just in a normal practice. You could work in some kind of dental specialty. This could be pediatrics. This could be orthodontics, oral surgery. Also, we see more dental assistants in schools, hospitals, public health, and military clinics. Either way, you'll be working closely with the dental team to help support patient care and different career paths for assistants. So just because you start out as a dental assistant doesn't mean that that is where you have to stay. There's different levels to dental assisting, so you can get different certifications to make more money and learn new skills. You can also decide that you want to be a lab tech or a sterilization tech, an instructor to a program, a front office or treatment coordinator. So there's a lot of different routes that a dental assistant can go throughout their career. Becoming a dental assistant, so most programs take about 9 to 12 months. Some dental assistants are also trained in a dental office. So you might have a dentist who has a front desk person or a sterilization tech, and they want to get into dental assisting. Maybe they even just need an assistant in a pinch. And then next thing you know, they're training them to be a dental assistant. In these programs, it would be a mix of classroom and hands-on training. So you have to learn the different numbers and names of the teeth, the different surfaces of the teeth. Um, you also need to learn the steps to different procedures, how different instruments are used, how we sterilize before you actually get in and get to do that hands-on aspect. Clinical externships are usually done in a dental office. And at the end of these kind of programs, you're usually looking at different certifications like RHS, which is that radiation one that lets you take dental x-rays. ICE is infection control, so that allows you to be able to be up to date with all of the correct infection control protocols. And then CDA is another certification altogether. It's certified dental assistant, and it also comes with 3 years of experience. So it's that knowledge and experience that then shows to your employer that you've put in the time in your career. Skills that you need to be a dental assistant. So strong communication with your patients and teams, compassion and professionalism. You want to have attention to detail and you have to be very organized. So sometimes the day gets very hectic. If you don't have those trays prepared, extra trays in the morning, if you don't have your lab cases where you need them and then you're rushing around, last thing you need to know is then to have to search for something. So organization and detail is a huge thing. Quick thinking and multitasking. So normally you're doing something like taking x-rays and then looking at them and helping to decide what's next. Obviously, the dentist makes the overall decision, but you kind of lead to those next steps and inform your patient of what may happen. And obviously, you always want to have a positive attitude and willingness to learn, but that's in any job that you're going to be a part of. Like I said before, the assistant is the heart of the practice. They're the first and the last person to see a patient. They create that comfort and trust in the chair. They keep procedures running safely and smoothly. If we get behind, they're the ones that are kind of doing that critical thinking to try to get everyone back on track for the day. They help reduce that patient anxiety, and then they make a lasting impact on every visit that that patient has. Rewards of being a dental assistant. So, educating patients on good oral hygiene habits. It feels really good when you have a patient that comes in and they had terrible oral hygiene. They weren't brushing, they weren't flossing, they weren't coming in for appointments. And you're able to help them take care of any cavities they have. And the next time you see them at an appointment, you see that they're following up with that oral hygiene, brushing, flossing, and that they're proud of what they're doing. Also, being part of supporting treatment plans, so getting to see a treatment plan from start to finish, same kind of thing. That patient that has to have, full mouth rehab, getting to see from the beginning to the end of that process, the where those teeth start and then where they end, and also the confidence of that patient when they leave. So the dental assistant is the foundation of every successful dental team. They're like the heart of the dental team. Thank you guys for watching my presentation, and I hope that you learned a little bit more about dental assisting. Thank you.